It's a deadly routine more than 1 million adults in Indiana still do, according to the Indiana Cancer Consortium. The state's smoking rate is among the highest in the nation. The new year often brings fresh resolutions, including snuffing out smoking. I spoke to local experts about ways prevention groups are trying to smoke preventable deaths. 1 year ends, another resolution begins. That is a typical pattern for many residents wanting to make a change, including smokers looking to put out their toxic habit. Ronnie Ford, the statewide tobacco and prevention cessation manager for the Indiana Black Expo, says the will to quit can come from a simple text.
You may get text messages, you may get phone calls to help you when there's times of day when you're most likely to smoke. Most people smoke through habit. You get up first thing in the morning, you want a cigarette. Well, maybe you'll get a text instead to say, hey, how's your day going? Did you get some coffee?
The tool is a tactic of the Indiana Quit Line, a service of the Indiana State Department of Health. It's free to anyone referred by an organization in the Hotline's provider network.
These are actual behavior cognitive coaches that are coaching people through this issue, and they are coaching them with techniques, evidence-based techniques that will help that person through it.
It's a line cessation experts want more Hoosiers to use. A study released this month by United Health Foundation found about 1 in 5 Indiana adults smoke, a number down 14% since 2012, but still higher than the national average. Ford says tobacco's toll is especially harsh on African Americans.
Even though we may smoke sometimes at even a lower rate than our counterparts, it affects us much more negatively.
Among the State Department of Health's priorities for 2015 is to eliminate minority health disparities related to tobacco use. Ford says start by targeting merchandise marketed to children and teens.
These are cigarella products that come from your neighborhood convenience store. We have whipped cream flavor, we have pumpkin spice, we have fruit punch. These are actual flavors that our youth are looking at each and every day and are looking at. This is obviously something good because it's got flavors and it's in the convenience store and it's cheap. And so it gives our youth the impression that I can start using these products. Most of the time they move on to cigarettes, and they also do them in conjunction with cigarettes.
A new PSA created for Black Expo chapter markets, including East Chicago and Gary, is another way experts hope to deter young Hoosiers before they grow up and light up. Franciscan Alliance Director of Respiratory Care Michael Meska says the region has among the highest smoking rate in the state. Franciscan's Northern Indiana Health Centers offer a new screening of lung cancer in an effort to catch the early stages of the disease, often linked to smoking.
What it does, it finds nodules at an early stage when lung cancer is not presenting itself through symptoms, but it's perhaps present, and when we catch it early, we can treat it more aggressively.
Meska hopes the screenings will become more routine for people aged 55 and older or current and former smokers. And he says a clean screening, especially for current smokers, is not a license to light up.
Deaths by lung cancer exceed the deaths from the next 4 cancers combined. There's a tremendous amount of energy and attention given to breast cancer, colon cancer, prostate cancer. All those cancers combined don't equal the same amount of cancer deaths from lung cancer. The number one preventative thing that we can do is not smoke.